Hey everybody, and welcome. This is our Regenerative Medicine Stem Cell Therapy webinar. I know that says seminar, but I hope you all are enjoying your lovely snowy day. Hey, look, I'm excited to share this information with you. This is the condensed version. I'm not going to take a tremendous amount of your time, but what I want to do is just get through a lot of the main questions that people have when they ask me about regenerative medicine and stem cell therapy, where we are now, where we're going, etc., etc. So, without further ado, I want to go through and just give you a couple of the disclaimers. Tonight's webinar is about educational purposes only. I'm just here to educate you. Stem cell therapy, I'm not promising you the world. I'm not telling you it's going to treat or cure anything. I just want you to know what your options are. Secondly, stem cell therapy, regenerative medicine is not approved by the FDA, meaning they have not put their stamp on here for me to be able to say that it treats anything. It is cleared by the FDA. There are steps that you have to follow to make sure that what you're doing is safe. But because it's not approved, that means that insurance companies, Medicare, etc., they're not going to pay for stem cell therapy or regenerative medicine. But we will go through pricing at the last part of this particular webinar. Intermountain Regenerative Medicine is a medically integrated clinic. That means that all of our therapies that are provided are done by our medical staff. We have a nurse practitioner that's absolutely fantastic at doing these injections. So she's the one that will take care of you come injection day. My job is to just educate you, let you know what your options are. Then we pass you off to the medical team and they make sure I did my job correctly and that everything is safe and you'll have the best chance at success when it comes to applying the actual therapy. Now, we utilize stem cells that come from donated human umbilical cords. We're seeing this less and less now, but when we first started, we sure got a lot of guff about using stem cells that come from embryos and aborted fetal tissue, etc. None of that has ever been true. They've always come from donated human umbilical cords from healthy moms, healthy babies. That means that you're getting the safest product available to both the baby and to yourself. So that's the disclaimer. With that, I'll tell you a quick story. This all started because of this guy. This was taken back in late summer. This is my dad about 10 months after he had his knees injected. When we first started this, no, I'm sorry, this was about 2 years after he was injected. When we first started this, Dad was scheduled to have both of his knees actually replaced. And I was looking into the research. I was looking at what it would take to actually be able to offer stem cell therapy. And when I saw what was possible, we jumped right in. Dad was the first person that we've injected. And to this day, he's never had to have a replacement therapy. And yes, both of his knees were bone on bone, and you should see him on his bike now. It's actually, it's inspiring, but at the same time it makes me laugh. So it's actually pretty funny. Resources. So there's a lot of people out there that need to see the absolute 100% proof that this is going to be a good fit for them. Unfortunately, that does not exist. However, stem cells and exosomes we're going to talk about, these are the most studied cells in the human body. So when you see these bogus news reports about stem cell therapy being unproven, unsafe, etc., they just they have not read the research. And a good chunk of that research is available on our website at iamregen.com/resources. You can also find testimonials there as well, because we're not going to spend a lot of time talking about testimonials or showing testimonials, because like I said, I wanted to keep this short. These are the questions that we want to answer for you. What is stem cell therapy? How long will the results last? Does insurance cover stem cell therapy? We've talked about that. No, it doesn't. Are there any side effects other than it may not work? No, there are no side effects. How is success determined? Why you shouldn't consider stem cell therapy? Sorry, that needs to be changed. And what is the cost? So here we go. This is Richard. I love Richard's story. He came to me 64 years old, needed to have a knee replacement, was self-employed, couldn't afford, no insurance, couldn't afford to have couldn't afford to have replacement therapy because for two reasons: expensive, and number two, he couldn't miss work. We injected both of his knees, and a couple of weeks after injecting his knees, he sent me these pictures of the jobs that he had done since having his knees injected. So that was pretty exciting. This is Pat. Pat came to us because of her back. She needed to have a back surgery. She didn't want to. She's 84 years old. And at the day we injected her, she had put money down. She had put money down on a to go into one of these retirement homes. She was going to get an apartment in a retirement home. And after the injection happened, her back was actually doing so well that she asked for her money back. She got her deposit back, and she actually moved into her own home. So we were really excited for Pat for her back and the success that we saw there. Now, I am Regen /testimonials. That's where you can find a lot more testimonials, a lot more videos of people talking about what they've done with stem cell therapy. As again, I'm not going to tell a lot of stories tonight because I want to get into the meat and potatoes. Currently, our office is at 2431 Jayfer Court here in Idaho Falls. This is where we do all of the injections. A little bit about me. I hate this slide, but I put it in here. I spent 13 years practicing and studying functional medicine, functional neurology, chiropractic neurology, and so we're helping people with an array of chronic disorders, chronic diseases. And up until about 2017 is when we jumped into the regenerative medicine, where I started to look into the regenerative medicine field. This is what we were doing, meaning we were helping people by having them change their diets, change their lifestyles. We're doing really well at it. Then I learned about stem cell therapy, and the big problem I had with it is that I personally couldn't administer it, so I had to get the best team that could, and that's where Sylvia comes in. Sylvia is a nurse practitioner, and she spent a lot of time. The reason why I hired her is because she says she had done more joint injections than I could count. And she also spent time on life flight as a neonatal flight nurse, meaning she was starting IVs on premature babies while airborne. If she can do that while airborne, she can find an IV on anybody. So we're really happy with Sylvia. She's really taken off with us, and we're happy she's here to provide that therapy for us. Now, let's jump right in and talk about what yesterday's path for a knee pain patient would look like. So the gold standard right now, and I'm going to go ahead and call it the old way of doing it, is for someone to go in and get medication when their knees start to hurt. So their joint starts to wear down, it starts to feel that it gets in pain. You start taking medications. When the medications stop working or you're taking too many of them, then you go to injections. You start injecting with steroids, which, by the way, steroid injections, you're only supposed to get 3 of them in your lifetime. Not 3 a year, 3 in your lifetime. They cause your kidneys to break down, they cause your blood sugar to spike, and they actually degenerate your joint to the point where you need to go get your knee to look like this, which is surgical replacement to put titanium inside of that knee. So what we're talking about today is avoiding this whole rigmarole just by one simple injection. Okay? And that principle is based on this. The power that made the body actually heals the body. Healing is actually encoded into your DNA. We are way sicker than our ancestors used to be. We need more options that are non-toxic, and what we're talking about today is one of those options. So healing is coded into your DNA. You're always regenerating, and here's some examples. Your stomach cells regenerate about every 5 days. Your skin regenerates every 7 to 10 days, and your red blood cells regenerate every 4 months, and your liver actually turns over every 5 months. This is cool. Your entire skeletal system regenerates every 10 years. So, what is a stem cell? This question was actually answered for me by one of our patients who said, asked the question, what is a stem cell? And he said a stem cell is like a blank slate cell. What he meant by that is a blank slate. What is a blank slate? A blank slate is literally just that. It's a blank slate that you can turn into anything. A stem cell is a blank slate cell. So in the beginning, it is just a cell. We all have them. We all have these blank slate cells in our bone marrow and all of our tissue that your body just hasn't assigned them to do anything yet. They are just a cell. That cell can be assigned to particular jobs based on the mechanism of the injury. So if you have cartilage that break down, those stem cells can become cartilage. If you have bone that breaks down, those stem cells can become bone. If you have a thumb you cut, those stem cells can become thumb. Okay? But a stem cell must have the ability to, number one, reduce inflammation. That's usually the first thing that we see. They fight off cell death. They have an anti-aging mechanism from which they can actually lengthen the telomeres on your chromosomes. They can differentiate into multiple tissue. What we now know is not the cell itself that turns into muscle, bone, fat, or cartilage. It's actually the exosome reaction that causes more muscle to be grown, more bone to be grown, etc. And they have the ability to self-replicate, so they can turn themselves over and replicate and build more and more of these things called exosomes to help your body regenerate and to re-heal itself. And I think this is just, to me, that's just awesome. So it's important to note here that not all stem cells are created equal. So when you read these stories online or these news articles online that are full of bias, by the way, they lump stem cells all into this big category of stem cells. Unproven stem cells is what they like to say in the news. Well, they're not all created equal. Okay? Stem cell therapy started in 2007 with bone marrow stem cells. So they would go in, and they still do this today. There's a lot of clinics, even here in Idaho Falls, that will do what's called autologous stem cell therapy. They'll take your own stem cells. So they'll drill into your bone. They'll take your stem cells out. They'll harvest those cells, re-inject them back into the site of injury, and hope that they regenerate and repair whatever that injury is. Now, that's great. You're using your own tissue, but the reality is that you are limited by your age here, because the older you get, the closer your stem cells are to death, the less you have of them, the less effective that they are. So they may not work the way you want them to work just based on your age. Same thing with adipose tissue. I think you're going to see adipose tissue be one of the first ones to go. They suck the stem cells out of your fat, put them back into you. A little bit of liposuction, not a lot. But again, you're very much limited by your age when it comes to adipose stem cell therapy. That takes us, so this is the first generation stem cell therapy. We're into the second and third generations now with donated umbilical cords. So a healthy mom has a live full-term pregnancy, and she consents to donate her cord to particular labs, and you have to be careful what labs you get them from. Those are more great YouTube stories about these labs that get shut down, etc. We've always been very particular about our labs. Our medical staff, our healthcare attorneys, we're always very picky about the ones we use. They take these donated cords. Our lab's in Utah. It's called Predictive Biotech. They'll take these cords, and if they don't pass all these stringent testing, then the cords themselves can't use. But if they can be used, that means that you're getting the youngest, most potent stem cells available. They have a replication rate of every 28 hours versus every 64 hours. They have more exosomes in these actual stem cells. They're more powerful, they're more potent, and they're viable, meaning they're frozen. Each batch is tested for disease, so they're safe. Each batch is tested for viability, so we know they're alive when they thaw them and inject them into you, which brings up a point that makes me laugh. People are adamant that stem cells cannot survive the freezing process. Live tissue cannot sustain the freezing process. If that were true, then why have we been doing this in cattle for, I don't know, decades? So they do survive the thawing process. But that takes us to the next level, which is exosomes, which we're going to get into the details about exosomes and, frankly, why they're superior for some conditions and why we use them. So those are your choices. Bone marrow and adipose, you're going to spend more money, and they are less effective. Donated umbilical cord cells and exosomes are the most powerful things we know about today. So what conditions are we seeing and are we using stem cell therapy for? Chronic joint pain, even bone-on-bone joints, chronic joints like knees, shoulders, etc. In otherwise generally healthy people, we're seeing about an 80 to 90% success rate with those issues, especially when there's knee injuries such as meniscus or ACL tears. It really doesn't matter because these cells have the ability to hone in on whatever the injury is and start repairing and regenerating that tissue. We're seeing it for low back pain and neck pain all the time. Don't know what happened there. Arthritis, osteoarthritis, tendinitis, tendinosis. I often make a joke that it ends with itis or osis. It's something that we can use stem cell therapy for. So the process works like this. On the left side of your screen here, this is a patient, a 55-year-old patient that walked into one of my colleagues' offices. His x-ray showed a 2.8 millimeter space between the top part of his knee and the bottom part of his knee, otherwise known as a bone-on-bone knee. He was injected with 1 cc or 1.1 million stem cells, and 4 weeks later, he comes back, and that space has gone from 2.8 to 5.3, meaning it's almost doubled in space because of the replication rate and the exosome reaction from these stem cells creating and growing new cartilage. He comes back 4 weeks later, so he's now 8 weeks post-injection, and that space is almost doubled. So there is evidence that this is regrowing. There's articles in that resources tab on my on my internet page, on my website. It does happen. They do grow new cartilage with these stem cells. So that's a case of a knee, hips, shoulders, same story. The injection happens into that joint space. With the spine, it's a little bit trickier because you can't go into the spinal canal, so we go into the muscles above the spine, and those cells, we have to rely on their ability to hone in and seek out what they're trying to replace or regenerate. That takes us to the 4th generation of regenerative medicine. Where we're at now is, what is a stem cell exosome? As I said before, we now know that stem cells, the reason they don't themselves turn into those different tissue, they secrete exosomes that tell your body to build that own tissue. The more exosomes you have, the higher concentration there is, the better they're going to work, the better they're going to do their particular job. So when we talk about age and stem cell therapy, if you're 65, your stem cells have a whole lot less exosomes than they would if you are, for example, 18. So stem cell exosomes are the little chemical packets that are released by the stem cells themselves that contain things like microRNA and messenger RNA that tell your body what needs to happen. So if it's a tendon that's torn, that exosome will say, hey, torn tendon, we need to create more tendon, and they'll carry that message out to have that job happen. I just spilled my water on my desk. That was awesome. Hey, so that is what a stem cell exosome is. So if we're using stem cells for osteoarthritic joints, what are we using exosomes for? We use exosomes for systemic autoimmune conditions. These are available to use via IV. So we use them for pulmonary issues. We can use them for overall health and wellness. This stuff I think is really cool. Sylvia went out and did some additional training so that we can actually use these for hair regrowth. They've been shown to grow new hair at a tremendous amount when injected directly into the scalp. Skin regeneration and facials, which I think is awesome. If you combine these with microneedling, the results are actually pretty astounding. Bladder incontinence, specifically for women. Sexual dysfunction for men and women's exosomes could be used for all of these things, and that's what we're doing in our office now. So back to these questions, and we'll wrap things up. Now, if what I've said makes sense to you, there's a link that you can schedule a no-charge consultation with me. We can do it here in my office. We can do it over the phone. It doesn't matter to me how it's done. But you need to schedule this ASAP because we're extending the whole Cyber Monday pricing. You'll see this here in a second. But that link is there for you to schedule so we can sit down and talk about this, what's going to work best for you. So what is stem cell therapy? We've covered that. It's taking these blank slate cells, injecting them into the joints or the exosomes into IV. How long will results last? We didn't touch on this one. We will now. There are research papers that say that it'll last from 5 to 7 years. I will tell you, the better you take care of yourself, the longer you'll get. Does insurance cover this? No, it does not. Are there any side effects? I tell people all the time, the worst thing that could possibly happen is nothing at all. They're either going to do what we want them to do, or they're going to do nothing at all, or they're going to go to some other area and help with something else because that's what the bigger problem, according to your body, was anyway. We just really don't know where that is until we actually do it. How is success determined? It's determined by you. Here's a perfect example. I talked to an individual today that would be thrilled if he got 25% improvement. Well, 25% improvement may be a complete fail to some, but it would be a world of difference as other. If you think 25% improvement's a win, that's awesome. We want to talk. If you think it's a total failure, then you see what I'm trying to say. Hey, why shouldn't you consider stem cell therapy? It's for those people. The people who shouldn't consider are really the ones that need absolute proof. They need, yes, I have people you can call and talk to them and see how their therapy does. But if you're one of those people that needs that, it's probably not going to work out for you. And the reason for that is because if you need that proof, that 100% clinical evidence, it's not there, you're going to come into it with the wrong mindset. And the wrong mindset absolutely 100% sets the thing going in the wrong direction. So we'll talk about all that during the actual consultation. And here's the cost. What is the cost? So if we just do PRP, we didn't touch on this a whole lot because I was trying to keep things short for you. PRP is when we take your own blood, we spin it down and inject it back into your joint. It's a great short-term fix, but it's not a long-term solution, and it does start at $595. Stem cell injections themselves start at $42.50. So 1 cc, if we're going to do one joint, think $42.50. If we're going to do two, then it goes to $67.50. If we use exosomes, if we're going to do an IV, they're typically $57.50. Our facials start with PRP at $13.50, and hair regrowth starts at $5,750. I did not put a slide about this in here, but what we are doing is for the end of 2019, our last injection date is December 19th. We're going to do 19% off these particular costs right here. So if you do the math on that, and this is where I apologize, I did not put a slide together for you guys on this. One joint is $42.50. You times that by 0.81. That'll give you, it's about $3,400 to do a joint, but that's only good until the end of our December, which would be December 19th. After that, it will not be available. So I encourage you to hit that button and set up the consultation. The consultation doesn't charge you a dime. Let's just see what's going to go best for you. Here is the payment options. I'm already giving you a huge discount, so this cash discount of 5% does not apply. But you can do half down, and you can do 3 payments over 90 days. We do have care credit and some financing options that will be available. We can talk about what works best for you there. But the thing is, the next thing is what's next, and that is just to schedule the exam. I'm doing the consultation for you at no charge. Please click on that link. Let's get this set up. My throat's drying out, so it's time to wrap up. I want to answer all your questions. I want to talk about your options. I'm going to stick around for a few minutes in case you have any questions. I can't get to those while we're actually doing the video, but I will stick around, and if you have any questions, shoot them into the comment area, and I'll do my best to answer them. Otherwise, time to click on that link. You can see my schedule. You'll actually book with me directly, and then we can talk from there. So thanks for joining me for this webinar. I hope you have a wonderful December. Great way to start it. Appreciate you being here, and we will see you very soon. Thank you.